Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a patient named Mrs. Thompson about diabetic coma. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the note.
Hello, Mrs. Thompson. Your primary care physician has referred you to me after noticing some concerns with your blood sugar levels. I understand you've been struggling with diabetes management recently. Can you tell me how you've been feeling?
Well, doctor, it's been tough. My blood sugars have been all over the place lately. Sometimes they're so high, and then they just drop out of nowhere. It's really scary, especially when I start to feel dizzy and confused.
That sounds alarming, Mrs. Thompson. Have you noticed any particular triggers or patterns in these fluctuations?
Not really. I've been trying to eat right and take my insulin as prescribed, but sometimes I feel like I'm losing control. The worst was last week. I felt so weak and I couldn't think straight. My husband had to rush me to the ER because I almost passed out.
That must have been a frightening experience. Based on what you've described, it sounds like you might be at risk for a diabetic coma, especially with such severe blood sugar swings. Let's go over your medication and daily routine to see if there's anything we need to adjust. When did you last experience a significant drop in your blood sugar?
Just yesterday, actually. I was feeling fine in the morning, but by lunchtime I started sweating and shaking. I tested my blood sugar, and it was dangerously low, around 50 milligrams DL. I immediately took some glucose tablets, but it took a while before I felt normal again.
That's quite low. How much insulin are you currently taking?
I'm on a sliding scale, so it varies. But lately I've been taking around 30 units in the morning and 15 in the evening. I also have a long-acting insulin that I take before bed.
Okay, and how have your blood sugar readings been before you administer your insulin?
They've been inconsistent. Sometimes they're high in the morning, like over 200 milligrams DL, and other times they're closer to 100 milligrams DL. It's hard to predict.
It sounds like we need to fine-tune your insulin regimen. With your blood sugar levels fluctuating so much, you are at increased risk for both hyperglycemia and hypoglycemia, which could lead to a diabetic coma. Have you noticed any other symptoms, like extreme thirst, frequent urination, or abdominal pain?
Yes, actually. I've been really thirsty and I've noticed I'm going to the bathroom a lot more, especially at night. I also had a bad headache a few days ago that just wouldn't go away.
Those symptoms can indicate that your blood sugar might be too high, which is just as concerning as it being too low. We need to address this quickly to prevent any serious complications. Have you had any recent infections or illnesses that could have affected your blood sugar?
I had a cold about 2 weeks ago, but nothing major. I didn't think it would have such an impact.
Even minor illnesses can affect your blood sugar, making it harder to manage. We'll need to be vigilant in monitoring your levels during times of stress or illness. Let's also review your diet. Are you following any specific meal plan?
I try to eat balanced meals, but sometimes I skip meals if I'm busy, or I'll snack on something quick, which probably isn't the best.
Skipping meals or not following a regular eating schedule can cause your blood sugar to drop too low, especially if you're taking insulin. It's crucial to maintain a consistent routine. I recommend working with a nutritionist to develop a meal plan that fits your lifestyle and helps stabilize your blood sugar levels.
That sounds like a good idea. I didn't realize how much my eating habits could affect things.
It's easy to overlook, but diet plays a huge role in diabetes management. We'll also adjust your insulin doses to better match your blood sugar patterns. I'd like you to start tracking your blood sugar more frequently throughout the day and keep a log of your readings, meals, and any symptoms. This will help us make more informed adjustments.
I'll start doing that right away. I really don't want to end up in another situation like last week.
That's the right mindset. With a few changes, we can significantly reduce the risk of a diabetic coma. Remember, if you ever feel symptoms like confusion, extreme fatigue, or difficulty breathing, seek medical help immediately. It's always better to be cautious.
I will, Doctor. Thank you for your help. I feel a bit more confident about managing this now.
I'm glad to hear that. We'll follow up in a couple of weeks to see how you're doing with these changes. In the meantime, don't hesitate to reach out if you have any concerns or questions.
I appreciate that. Thank you, Doctor.
You're welcome, Mrs. Thompson. Take care, and we'll get this under control together.
Extract 2, questions 13 to 24. You hear a doctor talking to a patient called John Parker about the potential diagnosis of Castleman disease. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. Good afternoon, Mr. Parker. Your GP referred you to me because your recent tests indicated something unusual. We are looking at a possible diagnosis of Castleman disease. How are you feeling about everything so far?
To be honest, doctor, I'm really confused. I've never heard of Castleman disease before, and I don't even know what it means. When the GP mentioned it, I didn't know what to think. I've just been feeling tired and unwell for months, and now this.
I understand, Mr. Parker. Castleman disease is indeed a rare condition, so it's completely normal to feel uncertain. It's a type of lymphoproliferative disorder, which means it involves an overgrowth of cells in your lymph nodes. Let's go over your symptoms and discuss what's been happening with your health recently.
Sure. It all started a few months ago when I noticed these lumps in my neck and armpits. At first, I thought they were just swollen glands from a cold or something, but they didn't go away. Then I started feeling really run down, with night sweats and losing weight without trying. I've had this constant low-grade fever too. That's when I decided to see my GP.
Those symptoms are consistent with what we see in Castleman disease, especially the enlarged lymph nodes, fever, and unintentional weight loss. Did your GP mention anything about the type of Castleman disease you might have? There are a few different forms, and the treatment can vary depending on which one it is.
He did mention there were different types, but he wasn't sure which one I have. He said something about needing more tests to figure it out. That's why I'm here, right?
Exactly. There are two main types, unicentric and multicentric. Unicentric Castleman disease affects only one lymph node or region of lymph nodes, while multicentric Castleman disease affects multiple lymph nodes and can involve other organs. The symptoms you've described lean more towards the multicentric type, but we'll need to do a biopsy and more blood tests to confirm.
That sounds serious. What's the difference in terms of treatment? Is it something that can be cured, or am I looking at long-term treatment?
If it turns out to be unicentric Castleman disease, surgery to remove the affected lymph node is often curative. For multicentric Castleman disease, the treatment is more complex. It usually involves medications to control the disease, like corticosteroids, immunosuppressants, or targeted therapies that block certain proteins involved in the disease process. Unfortunately, multicentric Castleman disease can be chronic and requires ongoing management.
I see. So if it's the multicentric type, it's more about managing the disease than curing it?
That's correct. But the good news is that with the right treatment plan, many patients can manage their symptoms and maintain a good quality of life. The treatment we choose will depend on your specific case, including how advanced the disease is and how your body responds to the medications.
I guess I'm just worried about what this means for my future. I've got a family, and I need to be there for them. How serious is this really?
It's understandable to be concerned, Mr. Parker. Castleman disease can be serious, especially the multicentric form, but the prognosis varies widely depending on many factors. Early diagnosis and treatment are key to managing the disease effectively. Some patients respond very well to treatment and can live relatively normal lives, while others may need more intensive therapy. We'll tailor the treatment to your needs and monitor your progress closely.
I appreciate you explaining this, doctor. It's just a lot to take in. What can I do on my end to help with the treatment?
Staying informed and involved in your care is a great start. We'll go over all your options in detail once we have more information from the additional tests. It's also important to take care of your overall health, eating well, staying active when possible, and managing stress can all help. And of course, keeping regular follow-up appointments will allow us to catch any changes in your condition early.
I'll do my best. I just want to make sure I'm doing everything I can. How soon will we know more?
We should have the biopsy results and other test information within the next couple of weeks. Once we have a clearer picture, we can discuss the next steps. In the meantime, if you experience any new symptoms or feel worse, please don't hesitate to contact me right away.
I will, doctor. Thank you for taking the time to explain everything. It helps to know what's going on, even if it's a bit scary.
You're welcome, Mr. Parker. It's natural to feel that way, but remember, you're not alone in this. We are here to help you through every step. We'll work together to manage this condition and keep you as healthy as possible. Take care, and I'll see you soon.
Thanks again, doctor. I appreciate your support.
Anytime. We'll be in touch as soon as we have more information. That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a patient talking to a pharmacy assistant. Now read the question.
Hi, I need to refill my prescription, please.
Of course. Can I have your name and the medication you need refilled?
It's Stephen Thompson, and the medication is for my blood pressure.
Let me check. It looks like your usual medication is lisinopril. Do you need it urgently?
Yes, I'm almost out. I'm worried about missing a dose.
I understand. Unfortunately, we're currently out of lisinopril, but we can have it ready for you tomorrow morning. We do have an alternative, though, enalapril, which works similarly.
I'd prefer to stick with lisinopril since it's been working well for me. But do you think I'll be okay missing a dose tonight?
It's important to stay consistent, but missing one dose shouldn't cause immediate issues. Still, I recommend getting the refill tomorrow.
Okay, I'll come back in the morning.
Now look at question 26. You hear a medical professional explaining hand hygiene protocols. Now read the question.
You'll have seen the announcement about the new hand hygiene protocols that are being introduced next month. I'm sure you've considered how these changes might affect your routines, and it's completely understandable to have questions. There's no doubt that stricter hand hygiene practices can significantly reduce infection rates, which is why these updates are essential, but I recognize that implementing new procedures can seem overwhelming, especially with your already demanding workload. I want to reassure you that we've carefully designed the protocols to integrate seamlessly into your existing workflows. We'll be providing comprehensive training sessions to ensure everyone is familiar with the new steps, and we've placed additional hand sanitizing stations throughout the facility to make compliance as easy as possible. Supervisors will be closely monitoring the implementation to ensure that it doesn't interfere with your duties, allowing you to maintain your focus on patient care without added stress.
Now look at question 27. You hear a nurse talking to a colleague about a patient. Now read the question.
Today, we're going to focus on Mr. Thompson. He's 1 week post-surgery after having a pacemaker implanted. There was some mild swelling around the insertion site, but that's to be expected. This is his first follow-up since the surgery, right?
Yes, that's correct.
Okay, so today, we're going to start with gentle massage therapy around the incision area to help reduce the swelling and promote circulation. This should aid in the healing process and decrease any discomfort he might be feeling. We'll also monitor the site for any signs of infection. Over the next few sessions, you'll see how the treatment progresses to ensure proper healing and to prevent complications. The main objective is to manage the post-operative symptoms and support his overall recovery, allowing the pacemaker to function effectively without causing unnecessary strain on his heart or surrounding tissues.
Now look at question 28. You hear a physician talking to a nurse about Mr. Roberts. Now read the question.
It seems that Mr. Roberts is still a bit dizzy after his endoscopy. Is he showing any other symptoms?
Just some mild nausea, which is improving. I'm going to check his blood pressure before he's moved to the ward.
Good. I've placed additional orders for his post-op care. He has a history of heart disease, so we need to monitor him closely. There's a risk of arrhythmia due to the sedatives used during the procedure. I want his heart rate and rhythm checked every 4 hours. Also, keep an eye out for any signs of chest pain or shortness of breath.
Got it. I'll make sure the next team knows to monitor him for any cardiovascular issues.
Excellent. If you notice any irregularities or if his condition worsens, call me right away.
I'll be on alert.
Now look at question 29. You hear a nurse talking to a patient. Now read the question.
How are you doing today, Mr. Harris?
A little tired, but much better. The bandage feels snug, but there's no pain, so that's a relief.
That's good to hear. We've made sure the wound is clean and dressed properly. The stitches should heal nicely, but you'll need to come back in a week for a follow-up.
Thanks. I'm still amazed that I could get the stitches done so quickly. I remember when I had a similar cut a few years ago, I had to wait hours before getting treated.
Yes, advancements in triage and treatment have really improved wait times. Just make sure to keep the area dry and avoid heavy lifting until it heals.
I will. It's just surprising how efficient everything was this time. I was expecting a longer stay.
It's all about getting you back on your feet as quickly as possible.
Now look at question 30. You hear a physiotherapist talking to a group of patients about the importance of physical activity. Now, read the question.
It's essential to recognize that regular physical activity plays a pivotal role in recovery. It's not just about regaining strength, but also about improving flexibility, balance, and overall function. Unfortunately, some patients are hesitant to engage in exercises, fearing that it might worsen their condition. However, studies have shown that inactivity can actually delay recovery and increase the risk of complications, such as muscle atrophy or joint stiffness. Our clinic has seen a significant improvement in patient outcomes by encouraging consistent, tailored exercise routines. In fact, our recovery rates are above average, with 90% of our patients achieving their mobility goals, compared to around 75% nationally. To sustain these outcomes, we need to emphasize the importance of staying active, even when progress feels slow. The key is to start gently and gradually increase the intensity under professional guidance.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear a doctor, Emily Thompson, giving a detailed presentation on hypothyroidism. You now have 90 seconds to read questions.
Hello, my name's Dr. Emily Thompson. I'm an endocrinologist, and today I'm going to talk about a condition called hyperthyroidism, a common disorder that affects the thyroid gland. The thyroid is a small, butterfly-shaped gland located at the base of your neck, and it plays a crucial role in regulating your metabolism. Hyperthyroidism occurs when the thyroid doesn't produce enough thyroid hormone, which can lead to a range of symptoms that may develop slowly over time. Many people with hyperthyroidism are unaware that they have the condition because the symptoms can be subtle and are often attributed to other causes. The most common cause of hyperthyroidism is Hashimoto's thyroiditis, an autoimmune disorder where the immune system mistakenly attacks the thyroid gland, leading to decreased hormone production. Other causes include surgical removal of the thyroid, radiation therapy for cancer, and certain medications. Hyperthyroidism is more common in women, especially those over the age of 60, and it tends to run in families. It's also associated with other autoimmune diseases, such as type 1 diabetes and rheumatoid arthritis. Symptoms of hyperthyroidism can vary widely, but some of the most common include fatigue, weight gain, cold intolerance, and dry skin. Many patients also experience constipation, depression, and memory problems. In more severe cases, hyperthyroidism can lead to a condition called myxedema, which is a medical emergency characterized by extreme fatigue, low body temperature, and swelling. However, with proper treatment, these symptoms can be managed effectively. Let me share a case I encountered recently. A 45-year-old woman named Karen came to see me complaining of fatigue, weight gain, and feeling unusually cold all the time. She had been experiencing these symptoms for about a year but had attributed them to getting older and the stress of her job. However, when I examined her and reviewed her medical history, I suspected hyperthyroidism. We performed a blood test to measure her levels of thyroid-stimulating hormone, TSH, and free thyroxine, T4, and the results confirmed that she had hyperthyroidism. Karen's case is a good example of how hyperthyroidism can be mistaken for other conditions or simply attributed to lifestyle factors. Fatigue, for instance, is a common symptom of many different health issues, but in Karen's case, it was a key indicator of an underactive thyroid. Once we had the diagnosis, we could start her on the appropriate treatment, which involved daily hormone replacement therapy with levothyroxine. This synthetic hormone is identical to the T4 that the thyroid normally produces, and it helps to restore normal hormone levels. When treating hyperthyroidism, it's important to tailor the treatment to each individual's needs. For most patients, the goal is to normalize TSH levels with the lowest effective dose of medication. This often requires periodic blood tests and adjustments to the dosage, especially in the first few months of treatment. Patients also need to be aware that it may take several weeks to start feeling better after beginning treatment, as the body needs time to adjust to the increased hormone levels. In addition to medication, there are lifestyle changes that can help manage hyperthyroidism. A healthy diet is important, particularly one that includes sufficient iodine, which is essential for thyroid function. However, it's also important not to consume too much iodine, as this can actually worsen hyperthyroidism or even trigger hyperthyroidism. Regular exercise can help manage weight and improve energy levels, which are often affected by hyperthyroidism. Stress management is also crucial, as stress can exacerbate symptoms. Another case I'd like to mention is a 38-year-old man named James, who was referred to me after his primary care physician noticed an enlarged thyroid, also known as a goiter, during a routine physical exam. James hadn't noticed any symptoms other than some mild fatigue, which he attributed to his busy lifestyle. However, his blood tests showed elevated TSH levels and low T4 levels, confirming a diagnosis of hyperthyroidism. In James' case, the presence of a goiter was an important physical sign that led to further investigation. Goiters can occur in both hyperthyroidism and hypothyroidism, but in James' case, it was due to the thyroid gland working harder to produce hormones, which is typical in hyperthyroidism. Treatment for James involved hormone replacement therapy, and after several months of adjusting his dosage, his thyroid levels normalized, and the goiter gradually reduced in size. When managing hyperthyroidism, it's also important to consider the potential long-term effects of the condition. If left untreated, Hyperthyroidism can lead to an increased risk of cardiovascular disease, particularly because it can cause high cholesterol levels. Women with untreated hyperthyroidism who become pregnant are also at risk of complications, such as preeclampsia, anemia, and even miscarriage. Therefore, early diagnosis and consistent treatment are key to preventing these complications. One of the challenges in treating hyperthyroidism is ensuring patient compliance with the treatment regimen. Because the symptoms of hyperthyroidism can be vague and develop slowly, patients might not realize the importance of taking their medication consistently. In addition, some patients may become discouraged if they don't see immediate improvements in their symptoms. That's why it's crucial for healthcare providers to educate patients about the nature of the condition and the importance of ongoing treatment. In summary, hyperthyroidism is a common but often overlooked condition that can have a significant impact on a person's quality of life. However, with proper diagnosis and treatment, most patients can manage their symptoms effectively and lead a normal, healthy life. Regular monitoring and a personalized treatment approach are essential to ensuring the best outcomes for patients with hyperthyroidism.
Extract 2. Questions 37 to 42. You hear an interview of Dr. Eleanor Hayes discussing AI in primary healthcare. Now, read the questions. You now have 90 seconds to read questions.
As AI technology advances, its role in primary healthcare is becoming increasingly significant. There's a strong belief that AI could revolutionize how healthcare is delivered, potentially improving both efficiency and patient outcomes. I'm Greg Palmer, and today my guest is Dr. Eleanor Hayes, co-author of a recent article exploring the potential of AI in primary care. Dr. Hayes, what do you think the future holds for AI in primary healthcare settings?
Well, Greg, I think we're looking at a transformative period in healthcare. AI has the potential to handle a range of tasks, from diagnosing common ailments to optimizing treatment plans based on vast amounts of patient data. What we'll likely see is a gradual integration of AI into existing healthcare systems, with AI assisting healthcare professionals in making more informed decisions. This transition will require healthcare providers to adapt to new technologies while maintaining the human element in care, which is critical for patient trust and satisfaction.
That's fascinating. Could you elaborate on how AI might change the day-to-day operations of primary healthcare providers?
Certainly. One of the primary areas where AI will have an impact is in streamlining administrative tasks. For example, AI can automate appointment scheduling, manage patient records, and even handle billing processes. This could free up time for healthcare professionals to focus more on patient care rather than administrative duties. Moreover, AI-powered diagnostic tools can assist in identifying symptoms more quickly and accurately, allowing for earlier interventions and potentially better outcomes for patients.
It sounds like AI could significantly enhance efficiency,
But how do you see the integration of AI affecting the patient experience?
That's a great question. The integration of AI in healthcare could greatly improve the patient experience, especially in terms of accessibility and personalization. AI can analyze a patient's medical history and preferences to tailor care plans specifically for them. For instance, AI could suggest lifestyle changes or medication adjustments based on real-time data. However, it's crucial to ensure that the implementation of AI doesn't compromise the personal touch that patients value. The challenge will be in balancing AI's capabilities with the need for empathetic, human-centered care.
AI is often seen as a tool for enhancing healthcare, but are there any concerns or limitations that you think need to be addressed?
Absolutely. While AI offers many advantages, there are also significant challenges that need to be considered. One major concern is data privacy and security. With AI systems relying heavily on patient data, ensuring that this information is protected from breaches is paramount. Additionally, there's the issue of bias in AI algorithms. If the data used to train these systems isn't diverse enough, there's a risk that the AI could make biased decisions that don't fairly represent all patient groups. Lastly, there's the need for healthcare professionals to be adequately trained in using these tools. Without proper training, the benefits of AI could be undermined.
Those are important points. In your article, you mentioned that AI could also play a role in preventive care. Could you explain how that might work?
Certainly. AI has the potential to shift healthcare from a reactive model to a more proactive one. By analyzing patterns in patient data, AI can predict potential health issues before they become serious, allowing for early intervention. For example, AI can identify risk factors for chronic diseases like diabetes or heart disease and recommend preventive measures. This could include lifestyle changes, regular screenings, or even early treatment options. The ability to predict and prevent health issues could be one of the most significant contributions of AI to healthcare, potentially reducing the overall burden on the healthcare system.
Finally, what advice would you give to healthcare organizations looking to adopt AI technology?
My advice would be to start small and focus on areas where AI can have the most immediate impact. Begin with pilot projects in specific departments or tasks, such as automating administrative functions or using AI for diagnostic support. It's also important to involve healthcare professionals in the implementation process, ensuring they are comfortable with the new technology and understand how it can enhance their work. Additionally, organizations should prioritize data security and ethical considerations, making sure that any AI solutions adopted are transparent and fair. By taking a measured approach, healthcare organizations can gradually integrate AI in a way that enhances care without overwhelming the system or staff. That is the end of Part C. You now have 2 minutes to check your answers.